why we love you.
Good morning. I'm Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, and delighted to be back with you in this cool, crisp morning. Hoping that you're doing well and staying safe from COVID. We have a great broadcast ready for you this morning. We are joined today by the Kansas Leadership Center, who is calling on all coaches, businesses, community members, pastors, neighbors, reporters, and people like you who are watching this program to participate in their Beat the Virus campaign. We like that plan. We will get to that in a moment, but first, Hawkeye?
Numbers.
What do you think?
Numbers are pretty good.
Yeah, not bad.
You know, I think they are.
Although it's all relative.
It is all relative. We want as few as possible. It's, really stable and has trended down since we had that acute number of 100. I think it was 104 that we topped out at for acutes. Right now we have 82 acute infections, 37 in the ICU, and 24 on the vent. We have a total of 157 still, so we still have 60 or 70 in the hospital for those total infections. But really, just the acutes are 82 acutes, so that's good. We would like it to decrease. Certainly, I think we see some optimism in the total number of new cases in the Kansas City area, which is continuing to trend down, just under 1,000 now. But I think the trend over the last 4 or 5 days has been really good.
It has been getting better, and so I like the trend. I want to see the trend continue. It's still a lot higher number. There's still widespread community dissemination of COVID-19, though, and I think I don't want people to say, "Oh gosh, we're better. Things are good. The trends are down." They're really, really, really high. So let's not get too cocky about where we are.
No,
folks,
I think we still, especially
really
as we're coming to the holidays.
Yeah.
People are going to be together. We need to be real safe during this holiday, because I think we expect everything for the holidays in 2021 to be much different than they are now.
So, we saw a pretty big upward trend before Thanksgiving, which really concerned us. So we've seen some increase post-Thanksgiving. It sounds premature. I'm relatively pleased with the increase that we saw. It wasn't as bad as I thought it was going to be. What do you think?
I mean, I totally agree. I think
that's because people actually took it seriously. They wore their masks. They gathered in smaller numbers. I think people took it seriously. Hats off. Well done, folks.
And we just got the Hayes numbers. I just sent them to you.
Okay.
And so while he looks at that, let me just see if there's any questions from report. Do you have the Hayes numbers?
Yeah,
let's do
27.
It.
So they're about similar to what they were. I think they were at 26 yesterday, with 22 of those active and 5 in the recovery phase. So they're holding steady, not up to that 40 where they had been at one point.
Reporter questions.
Hey, good morning. Cody Holyoke with Channel 9.
Hi, Cody.
Hello. As we talk about, and it's amazing that we're talking about 2 potential coronavirus vaccines at once, so I know you guys are pleased. Logistically, how is that going to work, keeping track of that? I know everybody gets a card, but even in the health system, as you're dealing with different types of vaccines, hopefully there are more than 2, on the horizon. How are you going to be able to keep track of that? Because obviously this isn't a mix and match venture as we're doing vaccinations.
It is not a mix and match venture at all. Yeah, you're right. So here's what happens. So here in the health system, we're in Epic EMR, so we know exactly what vaccine you got. And when you come in here, you get vaccinated. We know which one we're giving you. That's the one you're going to get the next time. And you get your appointment for your follow-up dose, and we know if it's supposed to be 3 weeks or 4 weeks. And you're right. In fact, the head of the FDA Advisory Committee indicated early this morning that he fully expected the Moderna vaccine to get the green light. So we think the EUA will be issued today. We think we're going to get vaccine early next week, and we think we'll be able to start hopefully giving some Moderna vaccine next week. Now, what we don't know right now, and really that's a KDHE question in fairness to them, is how they're going to distribute Pfizer and Moderna differently, because there are some states, and I don't know how Kansas will do this yet, and that not a criticism, just I don't know, but there are some places that are saying we're going to give the Pfizer vaccine to healthcare facilities, hospitals especially, because they will be better equipped to handle the cold storage and the shortened time that you can have to have it out before you have to give it. Whereas Moderna's can be out longer, and as a result would be better served going out to nursing homes, because the plan right now throughout the country is to use CVS and Walgreens to help do distribution. to nursing homes, which means it's got to go to the pharmacy, then it's got to get shipped, and they're actually having pharmacists deliver it themselves out to these different nursing homes. And so I think that will probably more likely be the Moderna vaccine, just because of the logistics that are involved. But we don't know that completely.
Yeah.
That is what a national trend has been. We'll see what it is here locally.
And to get to that first question, we, just as Dr. Steit said, we have the electronic medical record. We also have paper record. We keep track of volume given, of the lot number, date and time. So everything is recorded, both in the EMR and on the paper record for the recipient as well. This is done for influenza vaccine, for whatever vaccines we're giving. So that is nothing new for tracking.
Yeah, I think the final one is people who get the vaccine have to remember which one they got, because the final fail-safe is you. But I think most health systems are going to be well equipped to tell you which one you had. And for our patients, it's actually in Epic. You'll be able to tell which one you had, and so your appointment will say that.
Great, thank you.
Other reporter questions? All right. Well, before we go further, I want to welcome the president and CEO of the Kansas Leadership Center, Ed O'Malley. Ed, welcome. Ed, and I want you to tell us a little bit about what the Kansas Leadership Center is about. What is it y'all do? What kind of advocacy do you do? What do you work on? Are you building bridges? What do you do out there?
Well, the story starts 14 years ago with the Kansas Health Foundation, the health foundation based here in Wichita, a conversion foundation that was formed with the sale of Wesley Hospital years ago. They began to believe that the quality and quantity of leadership in a community is directly related to the social determinants of health in a community. They invested in the creation of the Kansas Leadership Center. And for 14 years, our main work has been building the capacity of Kansans to exercise leadership in community life. We do leadership training on a large scale. More recently, with this Beats the Virus project, we're really mobilizing that leadership to tackle a collective challenge, which I'll be happy to talk more about here in just a bit.
Well, I know that both Governor Kelly and Speaker of the House, Ron Reichman, both have praised your organization. You've got a lot of bipartisan support. Talk to us a little bit about that. How have you managed to bring Republicans and Democrats together?
Well, this project, Kansas Beats the Virus, it really is about giving Kansans, everyday Kansans, something they can be for, giving them a chance to be a co-architect of slowing the spread of this virus. So what I think folks on the right and folks on the left are loving about the Kansas Beats the Virus effort is that we're mobilizing everyday Kansans to come together in community life. So far, there have been 672 meetings across the state scheduled. 416 of those have happened. So these are people who have raised their hand, said, I want to convene people in my community to come up with an action project to slow the spread of the virus. This has all happened in the last 2 weeks. Okay? So these meetings are happening. It's incredibly impressive. And what's happening is people are saying, what can we do to help slow the spread among our people? So it might be a meeting of a church, or maybe of a school PTA, or maybe it's just a neighborhood association. And their mindset is, what can we do to slow the spread among the people we have influence over, the people we care about? I think it really connects to your question about why so much bipartisan support. It really connects with the heart of Kansas. Everyday Kansans stepping up, finding a way to solve a problem.
So your goal is to have 1,000 meetings before the end of this year. You're well on your way. Are you going to hit it?
We think so, but we have no idea. And sometimes I kick myself for coming up with that 1,000 number. But it was a big, bold number.
Right now, we're going to help you. We're going to say, folks out there, listen to this. This is a great message. You need to help organize a meeting and try to put these plans into action. So how do they contact you? If people are listening, how are they going to contact you to be a part of this?
So if you go to kansasleadershipcenter.org, kansasleadershipcenter.org, you can find all the information you need to learn how to get involved with the project. There's a map scrolling right now, I think, of all the different meeting commitments that are taking place across the state. All this is happening very rapidly. The goal is 1,000 meetings, each one generating an action project. These aren't just discussions, they're action projects. The goal is to have this all done by New Year's Day. It's a big, bold, audacious goal. We hope it's going to do our part to help slow the spread.
I'm going to give you a big applause because I'm going to hope that you're helping slow that spread as well, because you're on the team and we're on the team, and I like that team. You know, we've said all along, you have a strong defense and a strong offense. It's vaccine and monoclonal antibody therapy, whatever, that's the offense. This defense has to stay strong in order for us to stay safe. I understand you also brought along one of your newest and best teachers today. I believe is that right?
Yeah, that's right. Claudia is with me. Claudia is one of our wonderful teachers and does a lot of other things with the Kansas Leadership Center. But she's been right in the middle of hosting some of these meetings, facilitating some of these meetings, especially as we do outreach into the Latino and Latina community. So it's great to have Claudia along as well to talk about the project.
All right, I think you called her a critical champion in your campaign. So, Claudia, share us with some of the conversations and ideas you've come up with through the Beat COVID-19, or the Beat COVID-19, well, it is Beat COVID-19, Beat COVID campaign meetings. Walk us through one of the meetings you've had, some of the populations of folks that you've been reaching out to.
Good morning, thank you. Yes, well, definitely most of the meetings that I have facilitated have been in Spanish, and I'm very thankful that of all the effort that the Kansas Leadership Center has done in the last few years to reach out to other populations, like others than English-speaking populations, and particularly the Latino community, which is the biggest minority in the state. And it has been really inspiring for me to actually start giving back that work that we all need to do for a common purpose to our community. And some of the amazing conversations are people coming together and not really knowing what they're stepping into. Like, they just want to talk more about COVID. We don't have a lot of resources or spaces like that in Spanish. So they just come with a lot of curiosity and then start the conversation. And once we guide them through that conversation, then a lot of ideas start coming up, and that's just amazing. Sometimes we have a couple of people who come to the meeting and they're like, well, no, I don't think there's something we can do. Like, you know, if people don't want to wear a mask, they're just not going to wear it. And then eventually, like, another person comes up with an amazing idea about, like, for example, coming up with a contest of like the most coolest mask on social media, you know, and then the other ones start like coming up with ideas as well to build on that one. So there have been a lot of wonderful conversations. If I tell you specifically in the Latino community, most of the time their concerns are very similar about language barriers, awareness in our community. But at the end, everybody comes with like a different idea. Or like a different people in mind. For example, some of them focus on like the young Latino professionals or young Latinos, like teenagers. Others focus on like seniors. And then I've also done some of those in English. And it's just amazing to see all these people coming together and really owning the responsibility and that common purpose of stopping the spread of the virus.
Well, that sounds awesome. I so appreciate that you're out there. So from y'all's perspective, how often do you run into somebody who's an anti-vaxxer or an anti-masker, and do they come to the meetings, and what's that atmosphere like then?
Usually one of the first things that we ask them is like to listen with curiosity. So yes, we do have people with different perspectives, but so far everybody has been very respectful in following that ask from us on listening with curiosity. And yeah, some of them come with different perspectives, but usually they don't bring, I mean, we really try to stay focused on a solution instead of like bringing, like even if they come up with questions as testing and stuff, we rather just provide some of the resources that the state is already giving us, or like, you know, websites and stuff where they can be better informed. And so far, like I said, people even with different perspectives, at the end, we all just focus on the solution or the ideas that they have, and that has been amazing.
So these are virtual meetings largely, is that right?
Yes,
better be right. You better be right, otherwise you flunk that question. I'm just telling you.
No, that's
just kidding.
50 people in a room.
Yeah, that's right.
We're using Zoom, and then lately with the Latino community, which we have also a technical challenge there. Many of them are not familiarized with Zoom, so that we're also using things like Facebook Room, and they're working pretty well.
You started to say something a moment ago. I apologize. I think I cut you off.
No, it's okay. Yes, they're all virtual meetings. But one thing I wanted to say is to your question about, do people show up who, are anti-vaxxers or don't want to wear masks? I think a secret to this, a key to this has been, this is about giving people something they can be for. It's not about forcing people to be against things. So I'm sure there are some meetings that are taking place where people feel like, I don't know if masks are going to go over well in our community. Well, okay, what can you get behind? Can you get behind having virtual service at your church instead of in-person service at your church? Can that be your action project? So the heart of it is, let's let people be for something, and let's not force them to wrestle with where they disagree. Let's focus their energy on where they agree. The meetings have really been inspiring. And if I could just give you a couple examples of things that are emerging that I think will be inspiring to your listeners, your viewers. So a coffee, this is my favorite example, a coffee shop in Chapman, Kansas, the Irish Den coffee shop. They're worried that teenagers will be socializing through the winter inside homes. Their action project is to create an outdoor space with heaters and fire pits so teenagers have a safe place they can socialize through the winter.
I love that.
Isn't that great?
That is great.
One more quick example.
Please.
Technical College in north central Kansas, they have created quarantine kits, so boxes with goodies, toiletries, basic necessities, some fun things too. And their project is to give these quarantine kits to students in the college in quarantine, hoping to make quarantine a little more doable. So those students can stay in quarantine the full 7 to 10 days. Yet they stay in quarantine longer, will slow the spread. So it's really inspiring. And I think one thing we're learning is this is a healthcare challenge. Yes, it's a public health challenge by all means. It's also a behavioral psychology problem or challenge for a lot of people. And these action projects are really designed to let people who know one another help influence one another to do the right thing.
That's great. You know what I love? I love that it's a grassroots level, reaching out to people and asking them, how do we come together to figure out what does it mean to do the right thing in this community, whatever that community may be, the coffee shop community, the technical college community. How do we do the right thing to help somebody? That's the best. You guys are doing great work. Thank you. Well, Jill, let's turn to our community here of our listeners and see what type of questions they have.
Okay, well, one of the first ones we have is that a viewer was listening to the news this morning and believes that they heard the reporter say that if you get the Moderna vaccine, you don't have to wear a mask. They're confused by that, and they want to know, is that true?
Let's unconfuse them. You have to wear a mask. There is no question. You have to wear a mask, Hawkeye.
Simply said, yeah, that's correct. You still have to wear a mask. Everybody will be probably wearing a mask, whether you're vaccinated or not, maybe until this time next year. And we've heard Dr. Fauci talk about
sooner than that. Come on,
well, that's just what Dr. Fauci's saying. So
he said October.
Well, okay. Either way, until then, you will have to wear a mask. But there is a signal in some of those early studies that you may have a reduced transmission from the Moderna vaccine as well as the AstraZeneca. But that data is not fully elucidated yet. But nonetheless, the answer to the question is, even if you get vaccinated, whether it's Pfizer or Moderna, or if any of these other ones currently that are being investigated come to market, the plan is to still wear a mask, physically distance, not meet in large groups, and do those things that we've talked about.
And I think you've hit on the right. I'm teasing you about the exact data, what he said, but you know, the mask wearing, remember why you wear a mask. Why do you wear a mask? Is it A, to protect you, B, to protect others, C, to protect your dog and cat, or D, to protect all of the above? Okay, well, actually, the answer is sort of D, because we don't want to transmit it to our pets either. Yep. But, you know, really, it's to protect others, right? It does offer you some protection as well, but it really protects others first and foremost. So if you get the vaccine and you don't get as sick because you now have antibodies, that's a great thing. Do you still transmit the virus? That's the question. Yep. And there's evidence both ways, right? There's some things that have suggested you still have a lot of virus in your airway, even if you've been vaccinated, in which case you have the potential to spread it. There's also evidence that the amount you would spread, the time you would spread, the likelihood of spreading is not as high.
It's decreased, yeah.
So for that reason, you got to wear a mask until we can really eradicate coronavirus. And I think with the vaccine, that is 95% effective, that's really important. Now, the virus can mutate and change,
Yeah.
but the thing that's making it a killer is that spike protein. The vaccines are designed against the spike protein, right? So
Yeah.
now, granted, it's different sections of the spike protein, and that one section could come or go. But if the spike protein isn't there, this is just a regular coronavirus.
Yeah, yeah. If you're losing that interaction with your receptor in your body and it cannot bind as well or bind at all, then you really should not get infected if there's mutation. But to go back to that original question, yes, you still need to wear the mask. We also understand that certainly children we know can still spread the disease and get infected. We need the barrier on the wearer, but also some protection for the other person as well. So the answer is continue to wear the mask.
And some stuff coming out again last night now about 2 allergic cases in one hospital in Alaska. One of them who had to be hospitalized, a little bit more serious than the other. You know, it strikes me as odd that there would be 2 cases in one hospital in one day with that's one set of vaccines coming to them. Does that strike you as odd?
Yeah, you know, if we look at, you know, how many people have gotten vaccinated in the trials and now with this and those very few cases, you know, 3 to 4, we saw those 2 in England. I think that we still really need the details on those. One I heard about in Alaska certainly was a allergic reaction, but was well and got discharged the next day. You know, that's an extremely small number for all of the people that have been vaccinated. We know in the trials for both Moderna and Pfizer, there were no anaphylactic reactions or hypersensitivity reactions. So now there have been 3 to 4 cases in 50,000 total doses or more. That's an extremely small number, an extremely small percentage. So right now I wouldn't be too concerned with it, but that is why we have you sit and wait for 15 minutes, 20 to 30 minutes if you've had evidence of anaphylaxis to other vaccinations. This is not unusual. This is done with the HPV vaccine. This is done with the shingles vaccine. That's why we have that wait time after vaccination.
So, Hawk, one of the things that I'm struck by, how many deaths have there been so far from the coronavirus vaccine?
From the vaccine, I'm going to say none.
0. How many deaths do we have every day from COVID-19?
It was more than 9/11 every day.
3,000 deaths a day.
We
from
hit a record
COVID-19.
last night. I think it's like
We did.
3,700 or
We did.
3,600.
But if you say it's 3,000, so what you're really weighing is 3,000 deaths a day from COVID-19, 0 deaths a day from the vaccine. That's good math.
Yeah.
I think that's really good math. Next question.
Yeah, we got Max has a 2-part question for Ed. And the question has to do with, do you have any discussions going on about vaccines on these calls, vaccination? And in the second part is, when you have these action projects, where does the funding come? Is that a community grassroots thing, or is there funding?
So on the second question about the funding, so the state did provide funding for this project. So we do have a small pool of mini grant funding available. Those mini grants are up to $3,000. So many of these action projects are applying for those grants. But frankly, a lot of these action projects don't need special funding, or they're being funded through local sources. We didn't want money to be a barrier to the implementation of an action project, but we also didn't position this so the whole thing revolves around getting access to more funding to implement the action project. But so there is some funding there for groups who may need it. In terms of the first question about the vaccine, our focus right now is primarily on slowing the spread of the virus. That's how we've oriented these meetings and discussions. It has come up in our conversations, our internal conversations, about how another round of these types of meetings could be powerful to help share information about the vaccine, help spread the word about the vaccine, mobilize people to embrace the vaccine. Some of the action projects have started to focus on the vaccine awareness, but for the most part, it's been about slowing the spread of the virus for now.
Claudia, one of the things we're most concerned about, I think, is that historically in communities of color, there has been a greater reluctance because of, frankly, some difficult history with medical science, with experimentation and things like that. How do we convince people that the vaccine is safe? How do we encourage folks that this is a good thing to do?
I think in our Latino community, definitely language and the right language, not only just translation into Spanish, but just making sure that we have that trust. And again, there's been, especially with this pandemic, there's been a lot more awareness on local governments, even the state level government, on creating more information in other languages like in Spanish and creating that trust. Like I mentioned at the beginning, the Kansas Leadership Center has been working in this relationship with the Latino community for the last 3 years. And now we can start seeing those results where they understand what the Kansas leadership is about and they trust what we share to them. So I think that relationship with the different communities in our state would be will change the whole scene in the state.
Okay, thank you.
Okay, so Cindy says, when I wear 2 masks, my glasses don't fog. Is that added protection?
Hawk, added protection from 2 masks?
You know, I don't think it's going to be necessarily bad to do that. We don't recommend that. You know, the concern is, you know, obviously she's talking about not fogging for her glasses. We don't want your glasses to fog up. We know I've had a coworker who actually her leg broke because her husband's glasses fogged up and he tripped over her leg. So we don't want anything unsafe. But you're saying if wearing 2 masks protects your 2 masks protects your glasses from fogging up? I mean, I don't think that's a bad thing, but we certainly wouldn't recommend it. If you could do something to keep yourself safe otherwise, I don't really have any particular thoughts about that, no.
But I may have to try that because I'm a little clumsy and my glasses fog up when I wear a mask, especially if you come back inside on a cold day. Just be careful. One thing I would say is when you have a mask over a mask, make sure you don't distort the architecture of the mask such as you've created different spaces for your breath to escape more easily. And one way to test that is on a cold winter morning, like today, put the double mask on, go outside and take a big deep breath and blow it out and see if where it's escaping around your mask, and then try it with just 1 mask on and see how it does. That'll give you a pretty good sense of how good your breath cloud is like that.
Melissa read in the news of a new strain discovered in England in small numbers, where they have concerns reference in the efficacy of the vaccines in the case of this strain. Can you speak to that?
Yeah, I was in about 1,000 people or 1,400, I think, in England. I read that yesterday, and I didn't see any real concern raising about the actual vaccination because it didn't appear that the spike protein was gone.
Yeah, I mean, there were concerns about a strain from the mink in Denmark. That has turned out to be nothing. I haven't heard much more about. Certainly, I think these are interesting. We need to continue to follow up on them. It's a theoretical concern. We know that initially there were the reports of the D614G strain or isolate, which is an amino acid change in the spike protein that maybe said it spreads more readily than the original Wuhan strain. That's also combined with 2 other or 3 other mutations in that isolate to help it as well. So it may transfer more easily, be more transmissible, but there's no change in the clinical disease. The same thing with this English isolate right now in south of England. They are looking at it. They are continuing to follow. It's become one of the dominant strains in that area, one of the dominant isolates. But so far, they haven't seen any clinical difference. It doesn't make the disease more severe or less severe. There's no clinical difference in this other than maybe it is spreading more easily. But we have to remember, viruses mutate, especially RNA viruses. We know influenza is an RNA virus. HIV is an RNA virus. So seeing these mutations at the genomic level in the base pairs is not unusual. We know coronavirus, every isolate is probably 20 to 30 bases different. They have mutations than every other isolate almost. There have been over 12,000 mutations or changes from the original Wuhan strain noted in these coronavirus isolates. So that is not new. What we need to continue to monitor is if there is a clinical change. Does it make somebody more severe or does it cause more severe illness? Right now, there's no evidence of that. It's an interesting anecdote to look at and to continue to follow, but right now there is no real difference from that isolate to any other isolate.
Okay, we may have covered some of this, but questions for Claudia and Ed have to do around with just the structure of the meeting, like how do I become a teacher or a convener? How long did the meetings last? How many can you have in your group?
There you go, Ed. I think people are fired up. Let's do it. Talk about it. Claudia. Go ahead, Ed.
Claudia, yeah, so I'll chime in real fast, and Claudia can add in. The meetings last 1 hour, so these are tight meetings. We've designed them to be efficient. They're going to be facilitated by one of our facilitators. So when somebody raises their hand to say, I want to convene a group, I want to bring people together, we'll match them with one of our facilitators, somebody like Claudia or another member of the KLC team. You go to the website, kansasleadershipcenter.org. You can learn more there, how to get involved. There's an app that helps facilitate the whole process. It's pretty simple, pretty easy. But the meetings themselves last 1 hour, and we would love to have your help. We'd love to get to that magic number of 1,000. Claudia, what would you add?
I think you're right. Some meetings we get the maximum 15 people. Some others people invite their friends, and only 4 show up, and we come up with the meeting, and great ideas come up out of them. And I just be happy to reach that number, and a lot of amazing things are happening. I can also share with you a couple, like last night, I really liked this one where they were really concerned about our seniors in our families, because they were thinking that a lot of the times the grandkids, they will come and visit them and they will not wear a mask. And the grandparents, they're just as sweet that they won't say like, hey, don't come to my house. They're just gonna welcome them, right? So this group are making some gift bags for those seniors that they know in their community, and they're gonna create these buttons that they could use that said, you protect me, I protect you, something like that in Spanish. And then they're gonna give them some like a small gift and a mask, and for them to be protected and for them to feel cared. So that's one of my favorites. And like I said, the meetings last 1 hour, like Ed mentioned, and they usually go pretty fast.
Sounds great. And what's the maximum number of people you can have in one meeting? Did you say 15 or 50?
15.
15, okay. So it's a small group. You really can have a meaningful discussion like that. That's awesome. All right.
Okay, there's a question from a person who's really concerned still about this different strain.
Yeah.
And the scenario was that their daughter had COVID.
Mm-hmm.
She gets out of quarantine on day 12. Dad has COVID-like symptoms, but was diagnosed with a lung infection, and his PCR test was negative. They want to know if the second strain, this new strain, would have been picked up on the PCR test.
Yeah, Hawk, these are all picked up by that PCR.
Yeah, usually the PCR test, and especially here, and we've had extensive discussions with Dr. Leisman in our lab, because we have patients who come here and have had tests and are negative. These PCR tests that we're using are in conserved regions of the genome, so it's not on the spike protein.
You're going to have to define what a conserved region.
I'm getting to that.
I'm not sure I know, so I thought maybe the audience might not know either.
So I just want to say, it's not in the spike protein. In the conserved regions, I mean that these areas of the genome tend to mutate less and have less mutations, have less of a chance of mutation.
So they're called conserved because they're always present.
They tend to be conserved throughout all these different isolates. So there's very little change in these areas, even though I mentioned there have been over 12,000 mutations mapped to this virus. This area of the genome is really stable, so there's not a lot of mutations. So the base primers that we use for the PCR, and those are the chemicals and the molecules that we actually use to do the test, those are about 15 to 20 base pairs, so not very large at all. And so the chance of those mutating is extremely small. The bottom line is the areas that the PCR primers are attracted to in that genome really don't change much. And so there's no evidence right now that they are missing the diagnostic test, and we aren't diagnosing it because it's missed. There are other reasons, because tests are not perfect, even though these PCR tests are very good. There are other reasons why the diagnosis may be missed, but it's not for that reason. And, we have these issues at the health system, again, where sometimes somebody will come in with COVID, but they were diagnosed as negative, but then we find out it's positive. There are other reasons that the test may be negative. And so these discussions occur, every 3 or 4 weeks. But at this point in time, there's no evidence that the viruses are evading or eluding our diagnostic tests, our PCR tests. So,
yeah, and I think the key is that if a test is negative, the likelihood that it's negative because the virus mutated is like 0.
yeah.
The likelihood that it was negative because you don't have the disease is pretty high. And remember, you can still get sick from other common viruses. Or there is a likelihood that the test could be a false negative, and that can either be because the technique wasn't right or because the test, there is a false negative rate of about 2 or 3% of these tests.
Yeah.
And a lot of that is technique oriented or the machine itself or different things. So that's the likelihood. It's not that the virus is mutated and you suddenly got some crazy strain that we don't know about. Let's just put that one to rest.
Yeah.
And let's focus on the real reason that tests are negative. You know, I have a patient right now whose wife is positive, his son's positive, and this is a patient who's had some major medical procedures, and I'm scared to death. I'm like, oh my gosh, you're going to be positive. And he gets sick. And I'm sure he's positive, so we're all set to give him monoclonal antibody.
yeah,
Hawkeye even worked with me on that last week to get him monoclonal antibody therapy. Thank you for that. He's negative. I'm like, no, he can't be negative. We test him again. He's negative. He's got another virus at the same time. You know, that does happen.
Yeah.
Are we seeing influenza yet?
No. As
Thank
of
goodness.
last week, there were like 300,000 tests done or almost in the United States, and I think there were like 500 positive tests.
Yeah.
And I would venture to say, I was only able to deep dive into a couple states that looked like they had more. I would venture to say those are probably antigen tests, which if you have a low amount of disease in the community, whether it's influenza or whether it's COVID-19, if there's a low amount of disease in the community, there's a better chance that you actually have a false positive antigen test. And we do see that with influenza. So we are really trying to go away from the antigen test for influenza because of that. So I would venture to say a lot of those tests are probably influenza antigen tests that were positive. But to answer your question, there's an extremely low amount of influenza right now in the United States.
Hey, you know one more way you can prevent the transmission of influenza so you don't have to worry about that twindemic we talked about? You know how you prevent it? Wear a mask. Get your vaccine. Wear a mask. Just one more reason to love your mask. I bet there's 50 reasons to love a mask.
Yes, there are, and we're going to see those. And just anecdotally, I was talking with pediatrics yesterday because I heard Santa is coming.
Santa is coming.
He is coming.
What do you mean you heard that he's coming? Jill,
Yeah.
really? Come on.
Yeah. And I was asking them about their census up there. How many do you have? And the nurse told me, Andrea said that their RSV and their flu, all of that down this year.
I know, that's exactly. We're not seeing the RSV. We're not seeing influenza. And you know, the good news is that even at the North Pole, because Santa wears a mask and the elves wear a mask, you don't have to worry about COVID-19, influenza, RSV, so Christmas can continue.
Yeah, and not like Santa needs our help to tell him how many kids are in the peds, but we were checking.
I'm just saying that the North Pole
Right.
wears masks.
That's right. No, I meant mine. Okay, so I do have a question here. Lindsay wants to know, where are you recommending that people that are long haulers go for help?
Oh, man, that's a great question. Fortunately, Hawkeye, we've been working here
Yes.
on a clinic to handle long haulers.
Yeah, absolutely. For most of these long haulers, what we see as far as their symptoms go, it continues to be some brain fog. It continues to be fatigue, the shortness of breath, things like that, maybe aches. A lot of those symptoms will be managed in most part by your primary care provider for internal medicine. Obviously, for the cough and shortness of breath, the dyspnea on exertion, you want to see a lung doctor to really evaluate that. And for the brain fog, even looking at psychiatry, psychology, and neurology. So we have been in the works to create this virtual type clinic where there is a coordination between care in the outpatient setting, in the ambulatory setting, again, directed by Keith Sale, but also our internal medicine doctors, Brandon Comfort, one of our lung doctors, Dr. Leslie Spikes, in coordination so that we can get people seen and evaluated and get them disseminated to those specialties that they need to be seen. That will be coming online soon. We are working to get through all of more of the electronic medical record and workflow issues, but soon that will be happening, where you are able to try and get support for some of those long haul symptoms. We know that they can last for weeks to months after
You know
the
what
disease.
I think we need to do, Jill? I think we need to have a session devoted to long haul.
Yep,
And
all right.
we'll get Brandon, we'll get some of those folks
Yeah,
down here to talk about what
absolutely.
we're doing. So let's do that.
All right. It's
One
on.
more question.
Okay, so Glenn wants to know, are we here at KU seeing extra vaccine in our vials
Yeah, that's a
as
great
reported?
question. that just got reported yesterday that sometimes instead of 5 doses, you may have 6 or 7. And I think that's great. And the FDA said, go ahead and use those doses. We do have to figure out how we give people that next dose of drug.
Yep.
So we're going to have to hope they keep having extra doses in these vials. But we are just exploring that question. We'll let you know that tomorrow.
And just to piggyback onto that, we've done 30 so far. Our big ramp up and full steam ahead is today. We have 160 scheduled for vaccination today. But that is my concern. The regulators, like you said go ahead and use it. We need to make sure there's that 30 micrograms in each dose. Certainly getting more out of it would be great if you are having that 30 micrograms. So far, the FDA said it's okay. But what happens when we get the same shipment next time, but aren't able to get those extra doses? So
We
that's
got to
the
figure
concern.
that out.
Yep.
That's going to be a big piece of this. And remember, we hope for some good news today from the FDA about the Moderna vaccine. And Moderna can produce a whole lot of vaccine. They're actually geared up. And I think we'll talk more about that, but that may be some really good news. Hey, tomorrow we take a look back at how far we've come, and yet the hill still to climb. You know, we're going to answer your questions from the week. There are some very thoughtful questions out there. We want to make sure we get to those. And we'll be joined, of course, by Hawkeye and I, along with Amanda Gartner, our Director of Infection Prevention and Control. She's been on the program before, does a great job. And David Wild, who is a good friend and does a great job as well, and loves to show some graphs. So we'll talk with them tomorrow along with you. That'll be an excellent program. But before we go, Ed, final thoughts? Ed and Claudia both. Final thoughts. Let's start with you, Ed.
One, thanks for the opportunity to be with you today. And I just want all the healthcare professionals to know that all sorts of Kansans are stepping up in extra ways right now to help slow the spread. And I hope it gives some hope and inspiration to those who are in the hospitals, in the healthcare facilities, who've been working so hard. We're trying to mobilize as many Kansans as we can to help out a little extra right now to slow the spread, make life a little easier for you and the entire state. And I hope that brings you some inspiration and some hope as we head into winter.
And inspiration and hope often is what we've got to keep us going. Claudia, what do you got? Final thoughts.
Just piggybacking on what Ed just said, I want to thank you all the help. Thank to all the health providers. You guys have been working hard for us, and now, like Ed said, I hope that all these little actions that we're doing as a community help you and make you feel like the heroes that you are for us. Thank you.
And I'm going to help you guys. So here's the deal. You're going to count this this morning media session right now as one of your meetings. That gives you another one that you've had. You've reached a very large audience today.
Yeah.
But to our audience, hey, let's make sure we show them that leadership link so that people can get signed up to help come with the Kansas Leadership Center. Let's help them hit that 1,000 meeting goal to spread the word about how to handle COVID-19 and how to prevent the spread at a community level. We heard a couple of great examples from a coffee shop and a technical college already about things that they've been able to do. What other ideas are out there? Let's help Kansas beat the virus. Hawkeye, final thoughts.
Yeah, I think doing those types of grassroots things are awesome. Getting that outdoor space, we know that going indoors, we are anticipating is going to be more trouble for the United States in these winter months. If you can create those outdoor spaces, do that in distancing if you're meeting, with other people, not in large groups, but do that in a safe manner. I saw some pictures from New York where people are actually eating outside now in that weather. So it can be done, but do it safely. We know that there's still a long ways to go, but I think there's a lot of optimism with the Pfizer vaccines and now hopefully the Moderna vaccine as well.
As we sign off, we're going to show in just a moment some 5 of our front line workers who got their COVID vaccine on Tuesday. A big thank you to them for stepping up. And remember, even as we go on the offense, defense is still the key. That means you. Remember to follow those rules of infection control, right? Keep your distance. Wash your hands. Cough into your elbow. Don't go out if you're sick. Stay in small groups. Wear a mask. And even as we travel through the rest of this pandemic, there's still no place like home. Our first 5 doses.
It's very exciting. I think it's a game changer. I'm getting it for all of my family and friends.
It's surreal. This is like the glimmer of hope that we've waited months to feel and to have, and we need it, and I think we're all just super stoked that it's here. It's like a little bit of joy for the first time in a long time.
How do you feel? I feel like $1 million.
I got the shot for my wife, who's a general pediatrician, and I got the shot today for my kids. Hopefully this is the next step in things getting better for our community and for our country.
It means hope, that there's an end in sight. I took the vaccine for my coworkers who I've watched. I don't live with my family, but I've watched them have to sleep away from their families.
I'm honored. I'm glad that I can be a part of it. I really want this to work so that I can actually feel safer around my family and friends and anybody else in my community.